suspended the mystery shaker. No more mystery shaker for a while, anyway. But I see an anxious dollar waiting in the wings here, so we're going to go directly to the ever-present Director of Cinematography.
Oh, sorry, I'm just practicing. Nice tan. Golden tan. Good to have you back.
Our main man.
Well, I appreciate you following it up because it's not always going to work.
President Leroy, fellow Lions and guests, and
There's a noise out there.
Lion team, Tail Twister, Pat Fowler. So I want to personally thank you, Ken, for helping me with the boat motors project. Thank you very much.
Hi, Steve. Hi, Steve. Moving right along. Read. Push. We're going to this is Lion Sandy, who, by the way, was the executive director yesterday for our reading program up at Columbia Heights Elementary. We had a lot of fun, and she's going to probably describe some of that.
President Leroy, fellow Lions and guests, I have two sorry dollars. And the first sorry dollar goes to Louie and Cindy Fickett, who somehow I screwed up their sign up for Roar for Reading yesterday, and they showed up in the morning, and it was awesome. And they took pictures and whatnot. The second, I put two in, the second sorry dollar is for any of you who checked your email and got an invite to Roar for Reading in June. I was trying to make that dang My Lion app work and to see if we could use it for signups, and just don't even go there. So I apologize for that errant invitation for June. I will be soliciting for that later. And then a happy dollar. Oh, do we have to dissenting? That could be your dollar. Happy dollar is for all of those who showed up yesterday and helped with the reading distribution. It was great.
Your service project.
Lion Skip, would you like to, you make sure you... Okay.
Looks like he needs a donut.
Yeah, he needs a donut, and so all day yesterday he's going, Sandy, where's the donuts? Lion Skip.
And now for the rest of the story. King Lion, Leroy, fellow Lions guests, this is a caloric dollar. Howdy, baby, yes. Darn educators. Had a great time with kids up at the Columbia Heights Elementary School. I brought 6 bags of candy, and they were following me everywhere. It was great. Well, anyway, we had a good time reading with the kids. Kids got free books. Every one of you should take the opportunity to participate in this event. It's really encouraging and
Nice
kids
paint
are
on your
excited
face.
about little kids. And again, I was disappointed that there were no chocolate-covered donuts ready to go. And I wear a size 15 shoes now, so I can see my toes when I look down.
Easy boy. Past President Lion Cindy.
Hello, King Lion. Fellow Lions and guests, this is $5. 10. I can't believe I forgot to tell you guys a story that happened to me at work the other day. So my in-laws bought the drugstore that was next to our shop. So this guy comes into the shop and he's all jittery and slurring and doing all kinds of stuff. And of course, I was alone at the shop at the time. He was trying to tell me we needed to move our personal stuff out from behind our building so he could back up a 40-foot truck to the building next door that my mother-in-law owns. And he was in the shop for a good 15, 20 minutes. As soon as he left, yes, I locked the doors. And then the next day I filed a police report. This guy has got a criminal history with the police department. And I was told when I called back, if he comes back, not to go with the office number, but to call 911.
Yeah.
So that was my excitement last week.
Let's go easy. So, Chair, you've had time to get to chew. Cindy.
President, welcome back, President Leroy. Members and guests, I have $2. One was already taken care of for that education. It was fun going up there and seeing those kids. It is an awesome program. And the other one is that we went to Vader on Saturday for their crafty. What a fun event. Really need to support them. It was really fun and we had really good craft.
Gordy, how's it going?
Hell, I got a buck for that.
Well, all right then. Past District Governor Jim.
We're just getting the germs from the towel, not from the knife.
Kingland Leroy, fellow lions, distinguished tail twisters, ye with the sloping heads, $2. One's a happy dollar because unbelievable, beautiful weather out for 2 or 3 days this week, 2 or 3 days last week. The way I work, I'll have the lawn mowed in a month or two at that. And a sad dollar because Eileen wasn't here last week and she didn't get to hear everything I said. So I wouldn't repeat it, but people would boo. But it's nice to have her here today. You can share that.
Yay!
Here we go, Lion David.
President, acting president, or
I'm acting.
Actually, Dave's right, he's acting.
I'm acting.
President
Got a couple more months, then I'm done.
Leroy, fellow Lions and guests. $2 for, and handing $2 is for a good cause, and I thank you, and I'll just give it a rest for the singing for the thing. Bye-bye.
Yay, Dave. Fine Pat will be contributing to the cause today. Fine Pat.
President Leroy, fellow Lions and guests, the first happy buck is what a fun time at Lions Wade Smith's place on Saturday. He bought the right kit to rebuild a carburetor on a 1950s outboard. We got the pieces all together, we got the gas into it, and the thing just started right up. So I haven't lost my touch, Brother Al. Second happy buck was a great work party at Longview Yacht Club. The third happy buck turns out to be that on Monday, looks like you guys, you have me as a member of the Longview Yacht Club, so now I can actually get down to our boat. That's going to be more fun than before. And the last happy buck has to do with the fact that, I turned 61 on this coming Friday.
You're in that coronavirus danger zone. Fine Line, Ron.
Happy birthday to you. Happy birthday, dear Pat. Happy birthday to you.
That was just downright lovely.
I did not get you any pot.
I'll get it. Pat's own chair. Holy mackerel, look who just walked in the door.
Hello, John.
Fine, Greg.
It's a long way to walk.
President Leroy Collins and guests. Anniversary dollar. 41 years ago today, I married my current wife.
Everybody got a sad luck for Betty?
Past council chair, Hal.
Thank you.
President Leroy, fellow Lions and guests, I was just reminded, 61 years ago this week, my mother and father drove by in the car and they waved, and I was at the bus stop waiting to go to school, and I was going, finally, I got them out of the house. But they came back. And just so you know, that's back in the time when you had a baby. If you weren't there for a week, it wasn't really a real baby. That's right. And a second, yeah, that's right. 2 weeks for me. Yeah, that's right. Second happy dollar was our roof replacement of Pioneer Lions at Columbia Heights, and Sandy Cat is what you are. An amazing person. And all that you do.
Second Vice District Governor.
Going down for announcement?
Sure. And the love of my life, Carolyn.
You sound very excited. Welcome back, President Leroy, fellow Lions and guests. I have a happy dollar because there's several Lions in here that I haven't seen in a while. And I'm just glad that Lion Cherry got my mental telepathy thoughts about him.
His wife is thinking about you. You gotta set the bar a little higher, Marilyn.
Woo! Lion Treasurer Dolly.
President Leroy, fellow Lions and guests, a happy dollar today, my Lieutenant of Operations, Dougie here. We got the current policy manual and operations manual together, combined, because some people like to put it in Word instead of Excel. So it's a major accomplishment.
Control C, Control V.
What's that all about? Past District Governor.
Now you know why
Mark.
Dad wasn't allowed to sit at the table.
President Leroy, fellow Lions and guests, first dollar. I think I'm still slightly ahead of you, but we're getting close. Yes. Dollar number one, I'm very happy to see that Leroy survived the Sharks and Belize and made it back. Dollar number two, Steve is still really ugly. I have $3. I had to come up with something.
You really wrote that down.
And finally, I was very happy to have our kids and grandkids together to celebrate on Saturday that I am now Medicare eligible.
Anyone else? Okay, Leroy.
How about Doug? Who we go with you? This guy right
Line
here.
Doug, line Doug, you got to do line Doug.
First Vice District Governor, lined up.
This is either a happy or sad dollar. As I'm program chair, we don't have a program yet. So if he shows up, it'll be a happy dollar. If he doesn't show up, it'll be a sad dollar. A dollar nonetheless. John Morelli, he's He's our guest speaker.
Thanks, John. I appreciate it. Okay. Claypool. John Claypool. Got a couple of happy bucks, past presidents and fellow Lions and guests. Well, I'm glad to be back. It was a long 2 weeks, or short 2 weeks, in Belize. Had a great time. Some sunshine, some rain, some wind, a lot of snorkeling. Bar drinks were really fun. Next Tuesday, it's probably a sad dollar maybe. I'm not going to be here.
Hey! That's a happy dollar.
It's kind of a happy dollar. It's my 1 year checkup. So for all this stuff. So we'll see how it goes. And the following week, I'm going to be gone again. And I'm doing my part to stay with crowds. And so we're going to Disneyland. So anyway, there we are.
You taking a cruise?
No. Then I'll never come back. You get stuck.
Is that it?
Yeah, that's it. That's it. Anything else? You were? Okay.
God, I forgot about that.
Yeah. We need a bell with a lower pitch. Okay. Leading us today in our invocation will be past President John Claypool.
Father, we ask you today to watch over everyone in our world. Hopefully this virus that's going around will stay as it is and not be something really horrible. We ask you to watch over this Lions Club, all of the members also in that regard. We thank you for your help and all that you do serving our community as we continue to watch over it. We thank you for this food we have eaten, and we bless your name. Amen.
Pledge will be led by Bob Jessup.
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And our song will be led by Secretary Phil Olson.
My country, 'tis of thee, sweet land of liberty, of thee I sing. Land where my fathers died, land of thy pilgrim's pride, from every mountainside, let freedom ring. Thank you.
Hey Leroy, I have a way happy dollar.
Okay.
Drag it out.
You want the mic?
Hey, President Leroy,
Yes, sir.
we have a guest speaker in the house.
Oh, yay! And to start off with, we're going to have a late happy dollar by Phil.
President Leroy, fellow Lions and guests, this is actually a happy dollar for me, a sad dollar for Dolly. I noticed who was standing next to her during the singing of the song today, and that makes 2 weeks in a row that he's been there.
She's loved every minute of it.
Okay, do we have any guests?
President Leroy, Lions and guests, Mr. Patterson here has a gift.
Mr. Patterson.
It's a pleasure to introduce my guest sitting up at one of the head tables, King Lion Leroy. Good friend of mine and of many people in here, Bob Piper. Bob has turned in his application and has written a check. He will be shortly becoming our newest member.
Charlie, shorter than you?
The reason I recruited him is he and I have been seeing eye to eye for a long time.
Welcome, Bob. Okay, announcements. I guess that's all for guests? Okay, announcements. A board meeting will be March 19th at the Kelso Elks at 7 o'clock. So that's 2 weeks from now, about?
9 days.
9 days. There we are. The 2020 Lions Learning Forum has been postponed. And so it's been, right now, they've got it scheduled for Saturday, May 16th. So hopefully things will settle down and they can actually have it. So that's the 2020 Lions Learning Forum. Next up, let's see here. I always have to look at this to get the title right. Second Vice District Governor Marilyn Patterson has an announcement.
President Leroy, fellow Lions and guests. Again, I just want to remind all past presidents that a week from tomorrow, which is Wednesday, March 18th, Backstage Cafe in Kelso, and the president's meeting, past presidents, social 5:30, dinner at 6. And I think I've got everyone signed up that is a past president that's attending. If not, I have a sign-up sheet here so that you can order your food. For the new members, I just want to briefly tell you the past president's meeting is established every year, comes around, and our responsibility is to nominate the members that will serve on the board for the following year. And so that is why it's kind of one of those only meetings that only past presidents can attend. I was stumbling over that.
Good work. All right. Okay.
Is past President Ken going to be here?
Yes.
Super.
He should be on his way, if not soon.
Okay.
Oh, that's right.
Okay. Next is, well, sure, we'll go with past president, past whatever. Ready first.
President Leroy, fellow Lions and guests, one thing to add to what Marilyn just said, anybody that's interested in giving office for next year, whether it's a director or tail twister, line tamer, whatever, get a hold of any of the past presidents. Let us know. Okay, my announcements. First of all, Sight and Hearing Foundation meeting. Tomorrow night, it is not at Canterbury Park. They have excluded all outside groups from using their facilities. So tomorrow night, if you are interested in attending, it will be at Twin City Bank. We will have a key to get in and go upstairs to one of the offices there. The other announcement, who had planned on bringing a guest next week for our meeting? See, there's one.
I got one. Yeah, I got one ready to come.
Okay, apparently there's not enough interest to carry this through next week. So we'll plan it for maybe one of our meetings next month. So please get your people, friends, if you got any, relatives, and bring them to a meeting. So you can let them know what Lions are all about. Thank you.
Thank you. Thanks, sir.
Tina, do you have an announcement? Are you going to read it at all about awards for January or
Next.
February? You need to get her in the chairs.
That's next announcement. Huh?
We have an awards committee meeting right after this meeting. This here meeting, as our old friend Duncan would say, we're going to have a meeting right over here with Tina.
Yeah. Give him the mic. He just kind of goes. Yeah.
Wow.
Okay.
Okay.
Our next announcement will be Ron Stopler. I have an order here.
Yeah.
Just kidding. Yeah.
President Leroy, fellow Lions and guests, this is a Sunshine Committee report. Bill Pontius had some more health problems last Thursday. It was a TIA, which is sort of a mini stroke. He had a blood clot break loose, go through his brain, caused a little bit of damage. Nothing like a stroke. He should recover fairly quickly, but he's relearning how to read, and his dictionary is a little foggy right now. He cannot drive at this time, so just want to keep you posted.
Hey Ron, did you have something for Salvation Army too?
Just an early notice, the pardon me, White Cane Days is always the May 1st and 2nd. That is a Friday and Saturday, and because of our the way we work this, we've added the 3rd. So Friday and Saturday, May 1st and 2nd, we will be at Fred Meyer. Safeway. And then Sunday we'll be at Fred Meyer on the 3rd of May. Early notice.
Thank you. Thanks, Ron. Next will be past Council Chair Hal Palmer.
Most Honorable President, fellow Lions, and less honorable, tail twister. First, who in here has been touched by pediatric cancer? You know what? What a blessing. Oh, only Maryland. Okay? That is a real blessing that most of you have not. Lions Clubs International Foundation is working hard on the topic of pediatric cancer. The one event that's going on during the month of March by the Dino Dozer Foundation is their 2020 Gala on March 28th. If you have any interest in going to that gala, come see me afterwards, because I know when I started this club, we had a speaker on pediatric cancer. This was before your time, Steve. And that topic was really interesting to the fact that I wasn't even aware of it. But I got to tell you now, our entire foundation is aware of it. And it's just another reason for you to give to LCIF. Thank you.
Yeah. Next is Zone Chair Cindy Fickett.
President Leroy, members and guests, we have the spaghetti feed coming up, the Taste of Italy. So make sure if you haven't got your tickets, come see me to get your tickets. And sell them. We're going to do good. You really are. There's sign-up sheets right here. Be sure and sign up to get your favorite spot. Don't let someone else take it. So get over here and sign up. Thank you.
Thanks. And Marge for Sunshine Committee. Steve, Marge.
President Leroy, fellow members and guests, Ron just explained what's going on with Bill Pontius, and we have a card back here. And we also have a card for Gail Bradley. She's recovering from ankle surgery. So come and sign the card if you haven't already. Thank you.
Okay. Any other announcements? We received a invite from KLTV for their annual general meeting, which is Monday, March 23rd at 5:30, inviting us or inviting whoever would like to go to that. Anyway, if you want to go, here's the letter. You can come up and take it or whatever. We're a member, so whoever wants to go. And Dwayne works with them. So, that being said, I think we are ready to move on to our program. So, our program chair this month is First Vice District Governor Doug Harvey. It's all yours.
Thank you, Mr. President. For all those people that came today to hear and see that people from Camp Leo to receive their check from us may be disappointed because they're not going to be here. Over the weekend, I received an email from past International Director Roger Richard, who is probably one of the most senior people in our multiple district. And he was really excited about coming down here and seeing everybody, but his doctor recommended that due to the coronavirus, that he postponed this meeting. So he graciously asked if I could find a substitute. I said, not a problem. Well, I scoured and I did come up with a program today, and he had about as much notice as I did whether he's going to make it or not. But we are lucky to have today visiting us is Greg Pang from Hospice. He's the CEO of Hospice, and he's what they call MHA, which is a, I got it here in my notes someplace, master's degree in health administration. He's worked with home health and hospices for Good Samaritan in Puyallup, and also Group Health Cooperative of Seattle before taking over this project here in Longview a few years ago. He's been in this occupation for about 30 years. He's agreed to come and talk to us a little bit about the coronavirus, not as a professional as far as understanding the virus, but going to give us some insight as to what they have done in their organization to deal with this. And he asked me to give this specific note that he is pinch hitting. I just invited him yesterday. And discussing the coronavirus in preparation to the community. He's not a public expert. Anything he says cannot be held against him. And he says that he's been trying to figure it out just as we're trying to figure it out. But he does have some tips to give us. And at the age of a good portion of the people in this room is probably worth his time and our time as well. So at this point in time, I'd like to graciously introduce you to Craig Pang, CEO of Hospice. Craig.
Doug. Thank you. Good afternoon, everybody. Thank you, Doug. And President Leroy, is it? And fellow Lions, how are you? So, yes, I'm pinch hitting today, so I'll just give you some opening comments, and then I guess we'll open it up for discussion. How long do we have? 15 minutes, maybe? 3 hours. 3 hours. 3 hours. Wow. Settle in, everybody. So, coronavirus has been in the news recently, and Doug called me yesterday, curious about what healthcare providers are doing right now to protect our community. So I thought I'd talk a little bit about that. One of the things that Doug didn't mention is I've been with community home health and hospice for 15 years. This will be my 15th year this year. And so we've been in this community a long time, and one of our primary goals is to take care of the community. So here's some of the things that we are doing at community home health and hospice. So first of all, we are continuing to admit patients who have flu or flu-like symptoms. Now, you might think, yeah, so, but we have heard that there are home health and hospice agencies in our state through our association that have started to refuse patients who have flu and flu-like symptoms, which I think is criminal, because at a time when patients need you the most, you need to be there. And our staff are completely trained. Every flu season comes around every year, right? We go through the same protocols, and this one is no different. Now, we're being more vigilant, of course. So, because this particular virus is not like previous flu viruses. It's more virulent. You know, that means you can catch it easier, and it's more fatal, as in people with underlying health complications can get those complications more easily. So we need to step it up and be more vigilant, but it's not any different than what we usually do every year. We see flu patients all the time. Okay, so that's one of the things you'll find. I got to tell you, I can't find hand sanitizer or gloves anywhere. Can you? Anybody? Right? You got your own. Everybody have some? Who's got some on them right now, right? Everybody? Right? But you can find soap really easy, right? Have you guys seen that? Soap is like all over the store shelves, and so we have, and that is what we're telling our healthcare providers, all of our nurses and therapists and our aides, is that's the most effective way to kill the virus, is with soap and water. And we know how to wash our hands and sing happy birthday while we're washing our hands until happy birthday's done, right? And so we're encouraging people to do that. Hand sanitizer is a good fallback plan, right? Because it's very effective, but really soap and water is the best thing. Okay. Now, in our hospice care centers, right, we have a 12-bed hospice care center here in Longview, and we have a 10-bed hospice care center in Vancouver. What we're asking people to do there is to, if you have flu or flu-like symptoms, you have fever, shortness of breath, and those kinds of, fever-like or flu-like symptoms, please don't come into our facility, okay? Now, if you need to visit a patient, if you're coming to visit a patient, we will make alternative arrangements so that you can visit. So we'll try to seal off the room, for example, maybe have you come in through that exterior door of that bedroom or that patient room so that you can visit your loved one. But we're asking people not to come in. If somebody who is infected comes into the building and infects our staff, for example, and all of our staff have to call off because they're sick, that's going to make it harder for us to take patients. So we really have to create this environment for our staff that's safer. So we need a more controlled environment for people who are just coming in to visit. Does that make sense? Okay. So with regards to supplies, we are, I don't know, why is everybody stocking up on toilet paper? Does anybody get that? I don't quite get that. I was watching what is it? In case they can't get away from home. Like how much?
People and Lowe's is carrying toilet paper. This is weird.
I'm going, how much toilet paper does one person really go through? I mean, I'm seeing them going out with shopping carts of toilet paper and I'm going, I don't get that. Anyways, with regards to supplies, we have an adequate supply of hand sanitizer and masks for our staff. The government has also set up a method for us to go through the government to get their stockpiles of supplies if we start running low. And I think that the state is starting to stockpile supplies for healthcare providers in particular, because if the virus does, if it does break out and it becomes more of an epidemic locally, of course we're going to need those supplies. So there's stockpiles there. We're not, but we're okay with what we've got right now. Let's see. With regards to staffing, what we've told our staff, they know how to take care of patients in their homes. They know how to take care of patients in the care center who have flu or flu-like symptoms. They're following all of those precautions just like they normally do. We have been taking time to re-educate staff just to make sure that we've reinforced the education, how to wash your hands, when to mask up, when to use a shield and a mask and all that. So those are some of the precautions that we are taking. We haven't had any staff yet call out because of illness due to this. So I don't think there's a lot of exposure in our area at this time. So we're just gearing up and preparing in case that happens. I think the most recent case that I saw in the news was there was a single confirmed case in Clark County a couple of days over the weekend. I think that was Saturday that was confirmed. That's the only one I've seen. Has anybody seen anything other than that? Seattle, right? Right, so.
But the John Hopkins website is amazing.
John Hopkins website is amazing. I'm sorry. Yeah, absolutely. There's all kinds of resources out there. And yeah, one of the things, and it's a quickly evolving situation. For example, on the drive here from the agency, which is 3 blocks away that way, right? I heard on NPR, Jay Inslee just issued an edict for assisted livings and nursing homes that they're only allowing 1 visitor per day in those facilities per patient. Okay, so that's new. I hadn't even heard that. So that leaves me to go, well, are they excluding, does that mean only family members? What about our staff? Are we considered visitors? Yeah. Right, because we visit patients in nursing homes and assisted livings all the time. Right, so as this information comes over the airwaves, it leaves a lot of questions like, well, who does that apply to? And also they also said on NPR that people will be screened as they go into those facilities. This is in Washington State, okay? What does that screening mean? Does that mean a questionnaire? Does that mean here's your swab? Does that mean spit in this tube? What does that mean? I don't know what screening means, right? So these are all, again, every hour that goes by, there's something new that comes across the airwaves that we have to adjust to and figure out what that means. And so it's an evolving situation. Tomorrow there will be something new. I got to tell you, I think at our agency, I'm probably spending about half my time on coronavirus and preparations right now. And it's just what you have to do when these kinds of things happen. So, okay, yes, you probably have questions.
Another comment.
Oh, okay, comment.
I just got notice today that they've opened the exchange for an open enrollment period, special open enrollment period for next month.
Okay, Larry
Somebody
here.
that don't have coverage, they can apply for coverage and get it now.
Okay, you've heard that they've opened enrollment for
Health coverage.
health. Oh, so like the usual end of year open enrollment, they're opening it up again?
They're opening up again a special enrollment because of
For
the riot.
who's doing that?
State of Washington.
State of Washington. That's interesting.
Yes.
The healthcare authority. Oh, so what does that mean? So if you want to switch insurances or you want to enroll? Oh, if you don't have coverage, you can apply for coverage. Okay. I hadn't heard that. Yes.
I'm going to stand. You mentioned soap. My cousin, who knows quite a bit about medicine, has a website, wellandgood.com, and it's featuring a doctor who says soap is the best medicine. Soap and water says that the soap actually breaks down the shell of the virus, or there's a protective
Oh, how interesting.
portion of the virus. And that soap breaks through that virus and will wash off better than air masks and
Hand sanitizer, yeah.
It's also supported by a PhD from Johns Hopkins University as well.
Yeah. The benefit of hand sanitizer is that it's convenient, right? You can all carry it in your pocket. Whereas soap, you got to find a sink somewhere and all that, right? So, but anytime you can use soap and water, that's what we're telling our staff, use it. When they go out into patients' homes, they're going to be asking to use their sinks to wash their hands. Okay, other comments in back the room?
I was curious how much of a danger you think this situation is, where we have a group of people, mostly over 60, passing a microphone down.
Yeah.
Yeah. So I asked for hazard pay to come to your meeting today. I'm totally kidding. I'm totally kidding. How much of, everybody, you have to come up to your own decision on this, what your tolerance level is. I've heard anywhere from it's a proper precaution to it's an overreaction. Everybody's different, really, everybody's different. So I can't tell you what to think or what to believe or, your own health condition, that sort of thing. That's all up to you for now. So, yeah. Salt and pepper shakers are the worst things to transmit. And menus. Yeah. And money. Yeah. Credit.
Stop doing everything where you're at until the government says it's okay for you to do that.
Yeah.
Meanwhile, I'll take your money.
How are you doing? Yes, sir. Over here.
Those statistics that were this morning.
Let's listen to what the
statistics in this morning's Daily News came from Johns Hopkins analysis of China, which basically, let me see, who here is over 70? We have an 8% chance. Everybody else has less.
Better chance.
Jim, you got 23%.
Right.
I got an observation, a good chance.
Yeah. Oh, you have an observation?
Yeah, I do.
Oh, okay. Mr. Harvey has a comment as well.
You cut your hair, you reduce your chances.
Now, the information that I've received over a period of time about this, you can't hear?
No.
Well, excuse me. One of the things that I've heard about this virus is that the way it gets into your body is through your eyes, nose, and mouth. It doesn't come in through your blood or anyplace else. What I've noticed around here, as I've been watching, I have a lot of people that just automatically put their hands on their face, in their mouth, in their eyes. We really need to watch that. Because if you touch something and get something on your hands, it's not going to affect you unless you put your hands in your mouth, in your nose, in your ear, or someplace else that's...
So if you kiss, you don't slip on the tongue?
That's right. No, you can kiss, but no tonguing, okay? Thank you.
Hey, Doug, you have to remember it's his anniversary.
I got to come to these more often. Yeah.
There's one other virus you need to be aware of as well. If you own a Toyota, there is that coronavirus.
Oh, yes.
Find him!
Okay. Who in this room owned a Toyota Corona? They stopped those like in the 70s, like somewhere in there. They make Corolla now. But yeah, our family had a Toyota Corona. Yeah. Okay, are there other comments or questions that I can help facilitate? Yes, sir.
Completely unrelated to the coronavirus, I want to thank you for hospice and hospice in general. It's an amazing.
Hey.
We love what we do. We love what we do. Okay, so I've been up here 15 minutes. Is there anything else? I just want to close and say one thing. My community relations director is related to somebody in this room, John Morelli, right? So his wife, Mary Kay. I called her just before I came here to let her know I'm going to go speak at the Lions today. And she, you know what she says to me? She says, "Well, knock 'em dead." And I said, and then she immediately backtracked that and said, "Let me phrase that again." Yes, we have.
I'm sure many friends and family have used your services.
Yes.
But most recently, one of our greatest lions, George Moore, was in your hospice here, and he knew so many people in the community that, we really overwhelmed the nurses as to how many people came to see.
Yeah.
But it was just the best ever time.
I'm so glad to hear that.
We just thank you for that.
I think my clinical staff are angels. I don't know how else to describe them. I just try to get out of their way and let them do their thing because they feel it from the heart. And they love what they do. They really love what they do. And it takes a rare person, to do that day after day and come back doing it better and better every day. So I appreciate your comments, and I'll pass that along to the hospice staff for sure. Yeah. The transition choir. Yeah. They're amazing. They're great. Yeah. Oh, the choir that we have at the Hospice Care Center, they're volunteers, and they come in and they sing to patients in the care center. And it's beautiful, soothing harmony. It's all a cappella. They come in and volunteer their time, and it's just amazing. But we don't pay them. These are people like all of you who are volunteers in the community who are coming in and using your gifts and talents for our patients. And so we can't thank you enough for everything you do. And I know you've held fundraisers on our behalf as well. And that is what helps us keep doing what we're doing when we are feeling, okay, we're getting tired and we're doing this. We remember the community out there who's out there supporting us, and we keep taking one step after another and keep doing what we're doing. So, and we love it. So, yeah. Okay, anything else that you want me to know, take back, or questions? Okay. Okay. See ya.
Greg, I just want to tell you that when you come to a meeting like this, we observe your actions, and we make a decision whether or not you should be part of our organization. And I'm here to present you with this mug. Oh. But in that mug is an application. Now, generally before you're allowed to leave, you need to turn it in signed. However, if you don't, okay, I know where your office is.
Yes, you do.
So, thank you very much. What a great job.
Remind Greg that we were on our best behavior today.
This was your best behavior?
Yeah.
That was your best behavior? It sounds good.
Again, thank you very much, Greg. Appreciate it.
I'll be back anytime you want. Just give me a call.
Next Tuesday.
Next Tuesday.
Thank you. Okay. We'll move on to drawings. We have the white ticket. And that number is going to be 47202.
No.
4. Who? Steve? Jane, do you have anything for desserts? Gina. Oh, Gary.
Gina, I really want that pie.
Steve didn't pull the joker, so we'll go on to the next week. Red ticket, 926-507. Tom. Diabetes. Thank you, Tom. Secretary Phil, do we have any senility?
Amazingly, we do not, Mr. President.
Everybody's signed in. Super. Okay, just a reminder, there's an awards committee meeting after this meeting. So if you see Steve or Gina, wherever they are. I don't see Gina, but others, she's back there picking out a dessert. And don't forget also board meeting Thursday, March 19th at the Kelso Elks at 7 o'clock. So that's coming up. Anyway, hey, everybody stay healthy. Stay away from crowds. Stock up on your toilet paper.
I'll remind them about that.
Wash your hands. Okay. I'm supposed to remind you also that the postponement of the Lions Learning Forum, that's been postponed. So if you're planning on going to it, plan again.